I'm not going to just sell them a syringe just to sell them a syringe. So I'll give them a full consult. Well, this is the reason why. And in depth explain to them, and they really appreciate it. Once they understand and they're educated, like, okay, well, we need to do this and then correct this, then they'll get the best result.
Welcome to Henderson HQ. This is the podcast where you get all the stories behind the businesses that make our community tick. Don't forget to subscribe to our weekly newsletter. Hey, ladies and gentlemen, welcome to the Henderson HQ podcast, where we talk about businesses and business owners and business professionals in the Henderson area. Don't forget to subscribe to the newsletter and check out the website at hendersonhq.com. We have been slow over the last year to monetize this podcast or this newsletter and all the fun stuff that we've got going on. But one of the sponsors that we really do appreciate is Ethereal Med Spa here in Henderson. I met the owner right when they were opening. They've gone from expanding their product line dramatically, which is what we're going to talk about today. And by the way, for the guys that might be watching this, don't roll your eyes and tune out, because we're going to talk about a bunch of regenerative medicine, IVs, testosterone therapy, peptide stuff that's coming. For the ladies, we're going to talk about your skin. And there's a lot of guys that also need work on their skin. They're going to tell me everything that's wrong with my skin, because I took their little IQ test there and saw all the sunspots that I have on my face that might become problems in the future. So welcome, Natalie, advanced esthetician. I can never say that word correctly. And I'm excited that there's two different spellings of it, because now I don't feel so dumb when I can't say the word. And Pam, who does more of is an actual nurse who does more of the regenerative sciences there at Ethereal Med Spa. So let's start with my skin. Because I'm guessing people in Nevada should probably care about that, especially if they work outdoors. I mean, I have a lot of friends who their spouses or friends of mine, work at the pools, they work outdoors. I know some blue collar workers that work outdoors. So I think when people think about, a med spa, they're thinking about getting their nails done or they're getting a facial or whatnot. But the term that you guys have coined, which I really love, is a gym for your skin, which is like, you gotta take care of your skin, because I know people that have had skin cancer. I know people that have died of skin cancer. I know people that just want to look better. So tell me what's wrong with my skin, or no. Tell me why this is so much more important than people think.
Well, a lot of people are people want to look younger, longer, right? Because they want to match what they feel in the inside. And the technology that's available today, it really gives us the opportunity to do that more so than ever before. Just with the advancements in like skincare and with new like laser therapies that are out on the market.
So I'm 47, and I was born when my dad was really young. My mom and dad were right out of high school. I think they were 18 and 19 or 19 and 20 when I was born. And then my grandfather had my father when he was really young. So when I was a young man, like I'm 47 now, around 7 or 8 years old, my grandfather and grandmother look ancient, like ancient, like sit on the couch, smoke 2 packs of cigarettes a day, could barely they looked ancient. And now I run into 50-year-old, 60-year-old guys and gals at jiu-jitsu who, they look like ultra marathon runners. And I'm like, that is not what 50 looked like in the 80s when I was growing up.
Right.
So, I think a lot more people that are serious about it are taking care of their inner health. And like, why is the external health so important?
Exactly. I mean, because your environment affects you internally, right? And so if you're putting toxins obviously in your skin, and you really have to think of and I'm 53, by the way, I've been doing this for 28 years. And so
If you're listening to the podcast, she does not look 53.
But believe in the power of the product. So I started doing this at 23. And then, and actually, even before that, like in my own personal journey, like at 16, when I started breaking out, my mom took me to a dermatologist. And that's why I really started to understand the benefits of taking care of your skin, right? Fast forward 23, started off working in the hotel spa industry, massage therapist first, later went back to school for aesthetics. And I've been doing aesthetics for 28 years. And I've worked with, different backgrounds, dermatology, plastic surgery, medical spa. But really, what you put on your skin, what you do to your skin's the largest organ. So you have to think of like your skincare as nutrition for your skin. And this is the reason why you want medical grade or professional grade, because it's all about absorption. Just like what you take, vitamins, peptides, all of that stuff, right? It's all about absorption.
I mentioned this when the owner of your spa was in. I had done a loan for a guy that was making a massive amount of money, like absurd amount of money, getting makeup from China, bringing it in on a boat, white labeling it, and then selling it on Amazon. And when we were closing the transaction, I was like, hey man, like we did a great job. How about like a bunch of free makeup for our wives? My partner and I were talking to him, and he's like, Scott, you do not want your wife putting any of this stuff on their face. I'm like, what are you talking about? He's like, oh, all the product that I bring in, it's not tested. I have no idea what chemicals are in it. Yeah, it looks good. It creates great pictures for Instagram and Amazon. I would not have my wife put this on my skin. I'm like, well, you might be a horrible human being then if this is the stuff that you're selling and that you're kind of profiteering on. But it was really eye-opening to me because I don't know anything about the makeup industry of like, oh, this stuff really matters. Like the quality of the stuff that goes in it, we probably need to pay attention if it's what we're putting on us, right?
Well, medical grade and professional grade, there's efficacy involved, right? They're doing studies, they're doing trials. Like there's a lot of science behind it. When people go to, let's say, the cosmetic department and they're buying their name brand skincare, it's the same thing. They're not involved with the creation or the development or the harvesting or the science. They're doing the same thing. They're having laboratories create products for them. They ship it over and they slap their sticker on it. And I have a friend, her father actually did that for a living. And so I used to love going into his garage because he had boxes of makeup and lip glosses and things like that.
So
Yeah.
I want to get to Pam in a moment, but I want to close out this thread. If, I think obviously in the current time that we're in 2026, inflation, whatnot, people are pretty cost conscious. What is the like price gap between stuff you buy at your general makeup counter, you have no idea where it comes from, and then like coming to an actual med spa where I was there at one of your open houses and like the sales reps and the doctors that were there representing their products, like I got the whole spiel on like why this stuff is better. And I believe it. I don't feel like it was just gimmicky marketing. But what's like kind of the price spread? Is it 5% more expensive, 500% more expensive? Not that I think women really care what they spend if it makes them look better, or men. But like what's normally like the delta between the cost of like, all right, I picked it up.
It can be considerable. It can be, especially when you get into growth factors and peptides and things that are more like anti-aging, right? Because they're, again, it's just quality of the product and ingredients. Also, too, think of it like this: it isn't an investment. It's just like what you put in your body, nutrition-wise.
Right.
It's the same thing. Also, too, you don't need as much.
Yeah.
So, you're going to run through products like that you get at, certain department stores, or you're going to run through that stuff much quicker. Plus, is it really doing anything for your skin?
Yeah.
It's not really making changes. So that's why people invest, because they see the improvement and the changes that you can get from using good quality skincare.
It's funny, we'll close this out, but we downloaded this app called Yucca, Yuka. It's a little carrot, and you can scan pretty much any food or product, and it'll tell you like, is it good for you based on like a fat content, a sodium content? It'll tell you how many carcinogens are in it and whatnot. It's a very cool app. And my wife, because we have little kids, is very conscious about what goes in their body, right? Because that's what we're taught. Like you got to eat healthy food. You can't have this. You can't have that.
Right.
And so just for fun, this is like 2 Christmases ago, I went to, I will name them because you guys don't want to badmouth anybody. I went to Bath and Body Works. And I was like, oh, let me just scan these products. And the scale is on 1 to 100 for like quality. And then it's green, yellow, red, or like bright red based on the number of carcinogens that are in the product. There was not a single code or a single barcode in all of Bed Bath & Beyond or Body Works or wherever I was at that scored above 10 out of 100. And there wasn't a single product that didn't have at least 3 known carcinogens to cause cancer. And I called my wife. I'm like, I'm trying to get you stocking stuffers. There's not a single product you use that's not giving you cancer. And she's like, what? I'm like, go scan all of our shampoos and everything with this Yucca app. And it was like 17 chemicals known to cause cancer. And I was like, I was blown away.
And hormone disruptors, too.
Yes.
Yeah.
Hormone, men and women.
So let's go there, Pam. Since you're actually a nurse and you deal with more of the inside of the body, I know something that's on the roadmap for Theory Med Spa is hormone replacement. I'm the first one to admit to people that I'm on TRT for the last couple of years since I turned 45. I feel amazing. I think my testosterone was like down around 300 because I don't sleep and I don't eat particularly well. And I was working out so much, the doctor was like, hey, technically you're in the normal range, which like you can go down to like 300, 350. But historically speaking, that is not normal. She's like, with as much as you work out and like where your body physiology is, you should be close to like 700 or 800, maybe 1,000. And so I've been on TRT. It's like, I can't wait to switch over to you guys because the service provider I have right now is not great. But can you talk a little bit about like all the stuff? And I know you guys do the Botox and the beautification injectables. Like, can you talk about all the stuff that you guys do now and that's on the roadmap for the future to take care of people's inner health?
Yes, definitely. So hopefully this summer we'll be offering the hormone replacement for both men and women. not just men. I have been on hormone replacement since I was 45. I'm 63 now.
Again, for
And
those listening to the podcast,
it-
not looking 63.
Yeah.
You guys are doing something right over there.
it's taking care of your inside. So hormone replacement, peptides, we will be offering those hopefully this summer as well too, once we get the okay from the FDA to be able to release those to the public. But it's very important that you are taking care of your inside health, because as we're aging, we're losing a lot of cell overturn, and which affects not just your collagen, but other organs, which then affects how you feel and how you look on the inside and the outside. So it's very important. Plus, I do a lot of regenerative medical and cosmetic treatments. So PRF, taking your blood, spinning it down, and injecting it back in, causing collagen regeneration. I do it for anywhere's in the face, the hair, for hair regrowth. Great treatments. A lot of what I do is biostimulators, which is creating your own collagen to start regrowing again, over putting a lot of filler in. Once you hit over the age of 45, 50, you have to be really careful about overfilling, which a lot of people are becoming more aware of it. The trend is changing. People are not wanting their faces all puffy and filled with filler now. They want more of a natural look. And so that's where the PDO threads, the PRF, the Sculptra, the hyperdiluted radius is coming in, where we're giving everybody a natural, youthful look over a filler-filled face. So the whole regenerative medicine is definitely up on the rise, and that is including the aesthetic part of it as well too. People are choosing more of these longer-lasting natural approaches over putting a syringe of filler in their face.
So I want to go back to PRF real quick, and I'll get you in just a second. Go for it.
I just want to
Yeah.
add something. So, and we too combine therapies too. So, like very popular procedure right now is the XERF, which is the deepest non-surgical skin tightening treatment available. We combine biostimulators with that treatment, like literally same day, because it stimulates that collagen building in a much more impactful way.
So those like saggy lines I'm starting to get under my eyes, under my cheek, you can actually like, your stuff can regenerate the natural collagen. I don't have to get like a Botox injection in my cheek.
Right. So I would draw your blood, and then I have a special centrifuge. I spin it down. There's nothing in the tube. So it's PRF, Platelet Rich Fibrin. Everybody's very familiar with PRP more, and they kind of interchange. They're different. PRF is pure your blood. There is no separator in it. There's no other medications in it, nothing else, pure your blood. So I separate it, I pull out that serum, and I inject it back into the area that needs. It takes about 3 to 4 treatments face-wise. It takes about 4 to 6 treatments for hair regrowth. I mean, you're done at about a month apart, but absolutely amazing.
So you can get rid of this bald spot that I have forming back here.
You just I'll just literally inject it into your scalp.
Does it hurt? No, it can't hurt. It's gonna be a tiny needle, like
It's a tiny needle. It's a little uncomfortable. I mean, any needle going into the face is a little, or head is a little uncomfortable. But I do full body treatments too. So I, inject people with cellulite areas. They want their butt enhanced. We're going to be offering everybody's very familiar with Kybella. We like to use the lipodissolve, which is PCDC. It allows me it's more effective, and I can get a little bit bigger areas. So love handles, bra fat, muffin tops, I can inject it and it dissolves the fat, and then we can send them over to the combination of the ear hiding.
there's actually something that you can inject that dissolves fat.
We do, yes. So PCDC allows me to do a little bit bigger area. Kybella is the one that came out first. So it's dioxycholic acid. It's basically your bile, and it dissolves the fat and your body eliminates it. It's for small pockets of area. And I tell everybody about the size of a softball, an area that we can tackle, but it's great for that bra fat area, love handles, little pockets around the belly. I know bodybuilders that sometimes they get that stubborn little fat around their lower abdomen, and just a little injection there, it makes it go away.
And how long has this stuff been around, right? Because anytime I hear about anything that like anytime I hear about anything that can be like a quick treatment, my immediate response is like, oh, there's gonna be a lawsuit about this in 5 years.
Yeah,
But it sounds like the PRF and all this stuff, it's just natural. It's stuff naturally coming from your body.
it is, and they've both been around for at least 10 years,
Yeah.
at least.
Yeah.
So it's pretty safe to use. It's not an immediate response. It takes about 2 to 3 months to see. The same with PRF. You need the 4 treatments done over a month apart, and it takes about 6 months to get that collagen regeneration. But you will have, that's all I have under my eyes, is
So-
my own blood.
Hey guys, just a quick ad from our sponsors here that make this podcast and our newsletter possible. Want to give a shout out to Ethereal Med Spa, a gym for your skin. So it doesn't matter whether you're doing anything proactive all the way up to spot removal, all the way up to beautification, right? Or vanity. Ethereal Med Spa, they got you covered. Scott Wright over at Wright Auto Body, love them. So anything from a scratch and dent to a big insurance job, all the way up to a custom rebuild of a classic car, they got you covered. And shout out to my buddy Casey Halstead, owner of 10th Planet Jiu-Jitsu, which now has 3 locations. They just opened a new location on the west side. So they got our Henderson location, they got a mid-city location, and they've got a west side location. So anywhere in the valley where you're looking to train jiu-jitsu, check out 10th Planet Las Vegas. Now back to the show. Does this make any sense, or did my friend make this up? I think he did like a PRP treatment for like a torn labrum. He didn't want to get surgery.
Yeah,
So
or
they took out his blood, they spun it up, they injected it in. It's like the Diet Coke of stem cells or something. And then the doctor said, hey, there's some left. Do you want me to inject it into your forehead because you're starting to lose hair and stuff like that? And then they did that. And he's like, my skin has never looked better at 45 years old. And I'm like, what did you do? Did you go get Botox? He's like, no, they had some leftover juice from solving my labrum tear. And so they just injected it in my forehead. And I look awesome. And I'm like, well, I don't look at your forehead enough to tell, but I'm glad that you're excited that you look good.
Yep.
You know, you mentioned something that's near and dear to my heart, and I'll tell you why in a few seconds. But the peptides, can you explain to people what peptides are and what the current fight is over these? Because I feel like everybody, my personal opinion, I'm not a doctor. My personal opinion is anybody like you should be able to inject an unlimited amount of peptides into people that want them. But that has not been allowed for some time. So can you talk about what peptides are and what the current fight over those is?
So peptides are an amino acid chain. They're from our body, and over time we are losing them. And so they found a way to take this amino acid chain and to replicate them to do different things. Now, there is not a whole lot of knowledge, and you see a lot on social media,
A lot of bro science.
yes, and a lot of false information, unsafe practices, getting it from China, not correct mixing and dosing. Some of these cannot be taken continuous. Some of these have to be cycled on and off. There is a couple peptides that are FDA approved. They're all patient specific. But then the FDA kind of stepped in and said, oh, these work really well, so we're going to pull them. So there's about 12 of them that RFK, yes, got, so that hopefully they will be released to the compounding pharmacies so that doctors can prescribe them to you, hopefully July. The actual conference and official, I think, court hearing is in July. And it looks promising that they will release a list of 12 of them. I don't have the full list with me, but I know it's BPC, TB500, GHCKU, C-Link, C-Max, I think MOTC. There's a couple more and stuff that I just can't remember off the top of my head. But they're amazing for the body. If they're done correctly and they're stacked correctly, they can make you feel amazing. Retatrutide is going to be the number one GLP. It's actually a GLP-3 medication.
This is the Ozempic, the weight loss, stuff like that.
Yes,
Okay.
but it's more than that. And that's the reason why Eli Lilly is actually in a lawsuit right now with the FDA.
The pharmaceutical company?
The pharmaceutical company is in a lawsuit with the FDA. They've already went the first round, and the judge approved it to go to the next round in Eli Lilly's favor. And we're hoping that it doesn't go, because then Eli Lilly is trying to get the reclassification of the amino acid chain, the molecule. They want it classified that the molecule is larger, so then compounding pharmacies cannot reproduce it.
Because they would lose billions of dollars
They will
on
lose
fat loss drugs.
fat loss, but retatrutide has now proven that it's more than that. It is just utilizing many different areas of the body. They have, so far in the level 3 studies that they have done, it is showing to reduce breast cancer tumors by 30 to 40%, pancreatic cancers, lung cancers. They're shown a change in cardiology issues, heart disease, liver disease, lung disease. It overall in small doses. If you don't want to use it for weight loss, it just eliminates body inflammation, which 90% of us have body inflammation. Stress, our cortisol levels going up, then that automatically cause body inflammation. If you work out on a regular basis, body inflammation, which then affects all the different organs. When your cortisol level goes up, it affects your heart. So this helps just keep it down. And then when you combine it with these other peptides the correct way, your body is just amazingly healthy.
Okay, so I'm not a doctor. Disclosure for the podcast. I don't like to get political on this particular podcast, but I'm going to. I'm not a doctor. You're not giving medical advice. Consult your doctor. All the disclosures. Don't do anything that we're talking about just on your own without consulting a doctor. However, I've torn my hamstring twice. I tore it once the day I got out of the Army, which was 26 years and 26 pounds ago. I was in much better shape. I was younger. I was fitter. And then about 2 years ago, I tore it in jiu-jitsu. The first time I tore my hamstring, it was the night I got out of the Army. I got in a bar fight and did the splits that I did not mean to do and tore my hamstring. It was really bad. It took like 6 months for that to get better. Fast forward 25, 26 years, I tore my hamstring at jiu-jitsu, and I called my my PA and I was like, hey, there's all this bro science at our jiu-jitsu gym because we have a bunch of UFC fighters there. I want to recover as fast as possible. They're talking about this Wolverine stack, which is the peptide TB500 and BPC157. Can I inject this into myself, or am I going to give myself cancer? And she's like, look, I don't want to get into all the politics of it, but amino acids, you cannot take enough of them. You cannot OD on them. You as long as you're getting them from a certified place. She's like, the problem is it's very hard, nearly impossible for us to prescribe them because pharmaceutical companies can't make any money off them since they're naturally occurring amino acids. So between her and I conversation, consult your doctor, she's like, the conspiracy is the pharmaceutical companies don't want these released because you can solve a lot of problems for literally pennies a dose.
Yes.
And from what I've heard, because I was reading before you came in here actually about retatrutide, this is like Ozempic, but without getting the weird sunken in wave thing, because it does better.
It doesn't attack the muscle.
It doesn't attack the muscle and the bones and the ocular joints and all that stuff.
So it's got the glucagon receptor into it, so which helps with pushing that fat out more before it has a chance to go after the muscle. The problem is people transfer over from Ozempic or tirzepatide and go to retatrutide, and they start off on these really high doses. And you don't want to. You really don't need a high dose for retatrutide. You need a very low dose, and you just got to give it time to kick in. So people can still eat with retatrutide, but you're still going to see long-term effects months later.
Yeah.
But it's helping a lot of other things in your body too, not just targeting the weight.
Because everything that I've been reading is like retatrutide truly might be like the miracle drug, where since like 80% of metabolic disease revolves around inflation too, but inflammation. It's like, if I can have less inflammation, like you said, like less chance of like heart disease, less chance of cancer tumors, all this stuff is like super positive.
Yes.
All right. Well, hopefully in July, June.
We're hoping July is when they're I believe it's the next court date. So that hopefully that is approved and released.
I should invest in a compounding pharmacy because they're going to do very well if this works out.
They will. They will.
Natalie, I want to come back to you because one of the things that I appreciate about you guys, and I've learned so much about the medical spa industry since we've been doing the advertisement, and Val's been over there doing the social media and whatnot. But it's like, in my mind, as like an ignorant guy, it's like, oh, you go to a med spa when you want a facial at a very high level and you want to look better for 48 hours. And what I've noticed about your guys' business is, yes, you can do that, but there's more of like a consultative approach to like, hey, here's all of the things you should be doing for all of your body and especially for your skin, with it being the biggest organ on your body, like you were talking about. So can you kind of walk us through, maybe not every treatment, but like the beginner treatment of like, hey, I got a wedding on Saturday. I just want to look better for 48 hours, all the way to like, I'm really managing my skin to look better, feel better, cut down on the chance of skin cancer, all that stuff. Can you talk a little bit of the spectrum of all of the crazy, I mean, you have several machines over there that are worth more than my car. Can you talk about the spectrum of what you guys do?
I mean, everything from, repairing the skin barrier to anti-aging to corrective procedures like scarring or acne, loss of collagen and elasticity. So we cover the full gamut. So yes, people will come to us because they want to feel good, they want to have a good facial, but they also really want to look at improving something. So maybe someone has hyperpigmentation and related to like melasma, which is a hormonal imbalance, right? And so you get
Hyperpigmentation.
hyperpigmentation is dark spots or patches on the skin. So some of that's sun damage, and then some of it can be due to hormonal reasons. And all of those have to be treated differently, right? So because it's a medical approach, when we're going into procedures like lasers and deeper things, people have to be medically cleared first. That is the law because we're doing medical aesthetic procedures. So every treatment will start with a consultation. We have a 3D imaging system where we take a deeper look at the skin and see what's going on. And
That thing is rad, by the way.
yeah, so it tells us exactly. It's very cool. It's a very, very good, useful tool because looking at yourself, you would think, hey, you look pretty good. But when we go deeper, we see what's going on texturally, we see what's going on with circulation, and we see all the pigmentation that's underneath that's waiting to come out. So the things that we're doing are we're suppressing the melanocytes to control that pigmentation. But yeah, there's no one and done in any of this. It is continued maintenance, just like when you go to the gym or,
Right.
you go to get your dental cleaning, all of that. But people start off with a consultation first, and then we just assess, like, what's your game? Like, what's your goal? You have to listen to the patient, the client. What is your goal? You want long-term, you want quick fix.
Right.
Well, the reality is there's no quick fix, right? If they want to look nice and glowy for a few days or a really good facial, by the way, will keep you glowy for about a good week or so.
Okay.
Okay. And depending on what you're
Yeah, it's hot date.
depending on what you're thing at home, exactly. And so for that, we would recommend like a facial, right? Like, but a facial with technology. Okay. So hydrofacial, diamond glow, oxygen facial treatments. There's different things that you can add on to that too, like LED. A lot of people like the dermaplaning, which is a deeper exfoliation done with the scalpel. Doesn't hurt.
Wait, say that
Doesn't
too.
hurt.
Okay, you just said scalpel and my radar went off. It's like, I don't need a facial that involves a scalpel. Okay.
It feels good, actually.
Okay.
Yeah, but
And is it like I don't know what the term is, micro something where it's just like taking off the
that would be a microdermabrasion.
Okay.
And so that's where, and so we have hydrofacial, which is hydrodermabrasion. So texture tips that provide exfoliation plus deeper cleansing. So there's some suction involved in infusing the skin with specific nutrients, amino acids, peptides, growth factors, things like that. And you can do the same thing with the diamond glow as well. And then your oxygen facial is really it's repairing the skin. It was actually created by a respiratory therapist for burn victims, so very regenerative. And oxygen is a catalyst for collagen building too, right? So your skin literally feels full and lifted, but you're infusing the skin with nutrients, also with the oxygen. And it just, it helps to plump up the skin and stimulate collagen as well. So we would start with a facial first. If somebody wanted like longer, had longer term goals, and then that's a process. So for true skin correction, it's going to take about 5 to 6 months because there's just that many cell cycles that are needed. And that's going to consist of a skincare protocol, a regimen that you follow at home, because that's going to stimulate that cellular turnover so that when you come in for your procedures, you're going to get a better, more impactful result.
You guys have a tool that I was talking to Shannon and Vivian about, and I don't understand it because this isn't my world, but they were like, just think of it as a non-surgical facelift. So instead of having to get cut and tucked and all this crazy stuff and, be in bandages for a couple of weeks, they were like, this is the best thing on the market, because he told me how much the machine costs, and I was like, holy shit.
Like cost of a Bentley.
Yes.
Right,
Yeah. Yeah. He's like, in that room, I got a Bentley. In that room, I got a Ferrari. In that room, I got a Mercedes. Oh, that one's just a Honda, but we use a lot. So can you talk about that, whatever product or procedure you were talking about that's like a facelift without surgery?
Right. So it's called the XERF. It's spelled XERF, XERF. The energy radio frequency has been around, okay, but like just the technology and how we utilize it.
Energy, radio frequency.
Radio frequency is a type of energy, right? Just like laser would be another type of energy. And so what it's doing is it's creating bulk heating, right, into the tissue to stimulate collagen elasticity. What separates this modality from the others is that it's monopolar, meaning it's able to reach different depths of the skin more effectively, all the way down into the SMAS. So when you're having like a facelift done, that's where they're pulling everything back and they're tightening up the SMAS. So this energy targets all the way down, but it actually really is correcting skin tone as well and the connective tissues. So you do get real structural skin tightening. Now, some people are still going to be a surgical candidate, right? But some people don't want to go, they don't want the downtime. And if you do these types of procedures, it can literally help to, put off plastic surgery or delay it.
Yeah. And to me, it's like, I think of like, risk versus reward, like beauty versus like the outlier crazy case. If you're going under the knife, like you're going under general anesthetic, there's always a small chance that something can go horribly wrong. But if you're just shooting my skin with radio waves, what do I care? Maybe my face looks red for a couple days. I don't know.
Not even. There's no downtime with it because it's so deep. It treats subdural, so all the energy, all the heat is very, very deep. So it's not like a laser where you have to be mindful of the heat and the sun. It's not that type of energy. So you can do a treatment, and actually that's a really good treatment right before a wedding if you want to look a lip or snatch, because no one can tell you did anything, and you do see an immediate tightening of the skin. But true collagen building takes about 3 to 6 months. So you do 2 treatments. You do those 4 weeks apart. And like I was saying earlier, we combine therapies with that, with the biostimulators.
IVs. They get an IV before it hydrates your skin more, and they get a better treatment with the XERF with hydrated skin.
Because any skin tightening treatment is targeting the water in the tissue. So the more hydrated you are, it's designed to seek out the water in the skin. So that's where you get the tightening from, is from the that procedure. Sorry.
That's wild.
Out.
No, it's fine.
It's like, what am I saying?
I've become, Pam, I've become a huge fan of IVs. I travel a lot for work. I'll go to a conference. I'm around 5,000 people, and then I'm on a plane in, a tube of who knows what. Like, there's been a few times where I've come back, and it's like between the speaking and like the energy, exerted in running like a workshop and stuff, plus being around all these people that are coughing and shaking my hand and hugging me and everything, I'll come back from a trip and just absolutely burnt. And then, because I have little kids, as soon as I get home from a 3, 4, 5 day coaching event, the kids want to do everything, right? And I just want to lay on the couch. And so I have frequently come back from a trip, and the first thing I schedule is an IV. I know for a fact, because I'm pretty skeptical about this type of stuff. I know it's not a placebo effect. They're like, they put all these vitamins and crazy stuff in it, and I'm like, I feel so much better. Part of it's probably because I'm dehydrated, but part of it's definitely because like the direct infusion of like vitamins, minerals, whatever they're putting in those IVs, I don't really care because it works. So can you talk a little bit about IV therapy and like what you guys are offering there these days?
Yeah, I'd be, especially here in the heat, most of us are dehydrated. And so get even just a hydration IV, which is just a pure saline or lactate ringer IV, will just make you feel better, give you more energy. When you're dehydrated, you feel tired all the time. But if you want some energy, you went and you're working out, then we're going to increase some of those vitamins in there. It's electrolytes, basically, we're replacing. I can customize it to whatever's needs. So I go over a full medical history, see what's going on, and then I can customize an IV that will fit that person's need. Do we need to add some extra glutathione? Do we need to add some extra vitamin C? How are you feeling? That type of stuff. And then if they're really working out and stuff, the average person over the age of 30 are already losing their NAD. And
What's NAD?
So NAD,
or what does it affect?
It affects everything. It works at a cellular level. So NAD kind of helps, in layman terms, cell overturn. It's what kind of makes everything reproduce, getting those new cells, making you feel better. And as we age, that slows down to really low. There's some days you might have a little bit more, and some days you're not. So giving yourself the IV of the NAD just kind of help boost it back up. And it just helps with those cell overturn. It helps with energy. It helps with brain. It pretty much affects almost everything in your body. A lot of athletes will do it just because they're depleted of some things after they're working out, or if they're training or something, then they'll come in and they'll do the NAD. It's a long infusion. It's about a 2-hour infusion in general for the 500 milligram. If you've used it before and you do okay, you do it too fast, you will have some side effects.
Like what?
Really unpleasant side effects. You might feel some chest pressure. It won't harm you. We just slow the rate down. Swelling, head congestion, stomach upset. So it is meant to be a slow infusion. You need, and I've had guys that like, I can do it.
Yeah,
And I'm
gives
like,
you in 30 minutes.
just give it to me.
I'm a nurse, dummy.
Well, you can, and you can tough through it, but you're going to pee out most of it. So if you want to spend this money and get the effect of it, you got to let it go in slow. That way it's absorbed into the cells so it can do its job. But NAD is amazing. We are going to be offering Niagen. Niagen is what actually helps push to make that NAD. But if you're depleted with NAD, it's always good. If you've never done this before, we would start you on an NAD. The next treatment, which Niagen is also an IV treatment. They have it in pills too, but to get you started, we want to do an IV. Then the next treatment will be a Niagen, and then you can do the NAD again because it's going to help boost it back up again.
Interesting. So I'm thinking of, again, the jiu-jitsu gym we go to, a lot of very high level competitors, right?
Yes.
And it's crazy what they do to make weight. And I wish they would change this in the UFC and boxing, because I'm a big boxing and UFC fan. But, these guys will, on Friday before a competition, which usually happens on Friday or the following Saturday, they'll be 20 pounds heavier than they're supposed to be.
Yes.
And they just wring all the water out of their system by doing a crazy intense workout. And then starting about 2 or 3 days out, they'll start water loading with like a gallon of water. And then a day or two out, they'll stop drinking. The body still thinks it's hydrated, so it pees everything out. And they basically lose like 20 pounds of water weight. And then they're supposed to go 12, 24 hours later, be at their absolute best of competitive. And I'm like, none of this sounds safe. And by the way, like if you're depleting that many minerals, whether it's before the competition or right afterwards, you probably need to replenish yourself if you want to go back to training. Because I've seen some of these guys that just look emaciated by the time they're ready to like do a very important competition. It's just crazy to me.
It is. I mean, it's safer for people that are bodybuilding because it's for show. But if you are doing any type of fighting competition, it tires your body out and it actually affects the organs. And it isn't the best practice, but it is practiced out there. So it is very important that you replenish that because it can affect the kidneys, the heart. You're depriving them of the vitamin, the minerals, the electrolytes that are very important. You have an electrolyte imbalance, you can have a seizure. So you have to be very, very careful and just make sure that if you are doing that stuff, get rehydrated, do the NAD, do the vitamins and stuff to help load yourself back up again.
For the real psycho competitors that are maybe tuned in this far, could you do something like cut that weight? Not that I would recommend this, I'm not a doctor, but could you cut that weight and get an IV like the night before? Would that replenish you soon enough? Or how long does it take for like an IV to like uptake into your system?
It uptakes fairly quickly.
Okay.
Once we put it in, I mean, and we don't do it over slow time. I mean, we do. It's about an hour, but it's not like an all day thing. It starts to replenish in your body fairly quickly, and it lasts for a good 24 to 48 hours. We are not a medical clinic, so we can't treat anybody for medical stuff.
Right.
If somebody is severely dehydrated to the point they're sick, we have to send them to a quick clear. If they're just, hey, I'm tired, I'm dehydrated, I had to do this, then yeah, we'll give you a bag and you can come back in a couple days. But on average, we can only do the vitamins once a week. You don't want to over vitamize. And people think, oh, just vitamin. I can take this, and I can do a vitamin IV every day.
No.
You can't. It will affect your organs.
Yeah.
You can't do that. You can do some hydration extra, but you cannot do vitamins every single day.
So I want to switch gears a little bit just because we are in Henderson. Podcast is Henderson HQ. You guys work in Henderson. I think you live in the area as well. What have you enjoyed about building your business? Because I know again, in talking to the owner, it's like there's the business, but everybody kind of has their individual book of clients, right? Kind of like my barber, right? He works at a barber shop, but he has his individual book of clients. What have you guys found about building the business in Henderson, staying in touch with your book of business, maybe the other business owners that are watching this? Like, what have you learned about running the business of, repeat clients, all that type of fun stuff? I guess I'll start with you, Natalie, because like you're kind of servicing a book of business of clients, right?
Correct. Yeah.
So tell us about growing your own business.
So basically, it's you're building relationships with people. It's a connection. I love that people are happy to see me.
Right.
They look forward, especially when you are helping to achieve their goals. And so that people just enjoy coming and hanging out and getting a good treatment and feeling good, and seeing the progress.
They talk about the medical industry in general, right? Like the stats out there on getting sued. It's almost not even like the outcome of the surgery or whatnot. It's like the person's bedside manner, right?
Yes.
So doctors that have like worse bedside manner get sued a lot more,
Right.
because people are just unhappy. You're in a place where like, you're not seeing people in emergency rooms, so they're not at their worst moment ever. It's like people are happy to see you, and then like, I don't know, do you send them postcards or do you just text them, hey, it's time for your next thing? Or is it like once they come in, there's a scheduled plan for months out?
Absolutely. You put together a protocol, and some people just want to come in for the regular facials and maybe every once in a while do a treatment, do a chemical peel, do a laser. Totally fine. You're customizing it for each individual person, right? So everyone's, procedure or protocol is going to look different.
So since I've got some stuff done, you guys have a little dossier on my skin. You're like the CIA. I did that face IQ thing or whatever it was and saw all the underneath layers of my skin. I'm like, oh, dude, I'm going to be real ugly in about 10 years. And so now at Ethereum Mud Spa, there's a dossier on my skin. But what have you found about growing the business? Is it mostly referral based, or is it marketing, or is it all on your Instagram?
Yeah, it's all of that. It's word of mouth. It's definitely referral. And it's, here's the thing too. People find you when they're ready for you, right? So a lot of they're searching on, social media, or they're, Googling it or whatever, procedures and things like that. And then, if you're really good at like how you are marketing yourself, your business comes up. They find you when they're ready, and they could definitely, they come in. But it's all of that.
Nice.
And also just being really honest and ethical, and you know what I mean? So this is not a cheap industry. Like, treatments there's a cost to these treatments. And if you want someone that's skilled and experienced, there's a cost to that too.
Right.
So a lot of people are doing their research and they're looking for something very specific.
I don't want to go to a B- person if I'm putting chemicals on my skin.
Right.
Like doing a chemical peel sounds kind of scary. So it's like, I don't want to go to a B- esthetician.
Well, and also too, a lot, you don't want to just jump in into these treatments either. Sometimes people, they have to be prepared. They have to be pre-treated for a proper laser treatment. Not all lasers are good for all skin types. So understanding there's a Fitzpatrick scale that we follow. And so basically we're typing your skin within a certain Fitzpatrick. And so there are certain protocols in how we handle each skin types.
Yeah, it's funny because when you came in, you were like, "Oh, I'm an advanced esthetician." I'm like, I have no clue what that means. Means you're like, I've taken a lot of training. I know what I'm talking about, and I've done exactly what you're talking about. It's like it's a protocol thing, right? And there's the industry that I coach is the loan officer industry, and there's this big push right now, like, oh, well, if you're a realtor, you can just get your loan officer license, and like you can just do the loan. It's super easy, and it's like, I have 27 years of experience and I still get caught on stuff. I still make mistakes because there's a protocol because each client's financial file is different, right? Just like everybody's skin is super unique and different. So how long does it usually take, like in that initial consultation, to like come up with the plan and get people comfortable with what is kind of recommended?
So consultations are 30 minutes.
Okay.
So we're starting with imaging and then assessing what the needs and the wants are, and then you make the proper recommendation. Okay. So you're letting the patient choose how they want to approach it. If they want something that's going to kind of fast track, then this is the protocol for that. If they're not so concerned with time, then this is but we always start you off ideally with a skin program, like a skincare program, like a protocol, so that you know how to take care of your skin at home. And so that when you're doing the homework, you're coming in for the real work, and then you're going to get a better end result.
Do your homework.
Absolutely.
I'm not good at doing my homework, so I might not be a good candidate. I like forget. I just have like a pile of cream that I'm supposed to be putting on. I would forget every day before I go to bed.
When you start seeing changes in the skin, you get excited and you definitely start, you know what I mean? Yeah, you start looking forward to it.
And a lot of times, once the esthetician, if they're seeing them first, or if I see them first, I will then have the esthetician come in and consult them for the skin part of it or the laser part of it. So we kind of will share if she has someone coming in like, hey, let's bring the injector in. Let's let her look at to see what she can help with these. So we make a total plan with them, not just, just do the skincare, do this, whatever she needs. We try to incorporate everything that we do and make it available to them if they choose. That's what they want to do.
And again, that's where the vitamins and the IVs play a huge role
Yeah.
because you're going to get a better end result with any laser or skin technique procedure when your body's properly hydrated and you have the proper nutrition.
So I want to go to like the crazy questions because that's who I am. Has there been a situation, or do you guys have any stories of like somebody came in, this is what they wanted, and I had to talk to them about that's not for you? Or has there been any situations where you're like, hey, we're seeing something that like this is not a skincare issue, this is a dermatology or maybe a medical emergency? So do you guys have any crazy stories like that where we've had to turn people away, convince them that it's not the right treatment plan for them because they saw something on Instagram, or it's like, oh no, this is a real dermatology emergency that you need to see a doctor?
Yeah, definitely, especially in the injector world and stuff. A lot of people don't really understand what's the difference between a filler or a neurotoxin, and they'll come in and what they see is what they see that is bothering them. They don't understand facial anatomy, so they don't understand that, well, because they have lines around their nose, they want that filled. We don't want to fill it. That's the problem. We want to correct the cause. And the cause is on the upper part of the face here. So I have to explain to them, we can't do that. You're not going to like the result. I have no problem telling people no. I'm trained to look at the whole face, the whole body, and I'm not going to just sell them a syringe just to sell them a syringe. So I'll give them a full consult. Well, this is the reason why, and in depth explain to them, and they really appreciate it. Once they understand and they're educated, like, okay, well, we need to do this. We need to do this in this step, and then correct this. Then they'll get the best result. I haven't had anybody complain so far.
Right.
Not good with
No,
19 years.
You haven't had somebody say, but I saw it on Instagram, it's gonna work, just do it.
You do. They
Yeah.
come in and like, I saw them on Instagram. I want this, and I'm like, that's not what that is. And no, you don't want that treatment.
Call them TikTok docs.
Yeah, TikTok dogs.
Yeah. What about you? Like, what do you do when people come in and they're like, this is the result I want to have? And it's like, well, maybe that ship has sailed, or maybe that's not the right program for you. Or, you're 62 and this model is 22. Like, there's limits to this stuff. Like, how do you have those tactful conversations?
A big part of what we do is manage the expectation, right? So you give a realistic approach. Some things we're not going to be able to make go away. Scarring, you can't make scarring go away. There's certain types of hyperpigmentation that you can't completely make go away. We can help to make an improvement, though. We can help to make improvement. We can help to get their skin in a healthier state. So it's really just managing the expectation. And also, as an esthetician and an advanced esthetician, I see a lot of, different skin conditions. You have to know when to say no.
Mm-hmm.
Someone that comes in with like cystic type acne, right? That is a dermatology issue. I can help with the outside, like helping with scarring and things like that. But that is something that they need to be seen medically because there's usually something internal going on.
Right. Yeah, that's an interesting thing that I didn't think of. Like, how much of what's getting expressed on your skin is a problem that's like internal?
Correct.
A lot.
Yeah.
A lot.
A lot can be.
Absolutely.
Yeah.
I was talking to one of the poor kids at our gym, amazing competitor, and he's got psoriasis, I think. So getting like red splotches and whatnot. And I'm like, bro, I don't know anything about anything. I barely graduated high school, but I would think possibly a super healthy guy like you, there's probably something going on internally, either with diet or allergy or something that like, your normal super healthy 23-year-old probably shouldn't have massive skin conditions, I would think.
It could be hormonal. It could be an autoimmune disease that's underlying that they haven't tested yet. So it could be anything, especially teen boys. they're sweating, the hormones are changes and stuff. So it can be a lot.
And
A lot
of
of
triggers, things
yes,
that it
they're
triggers.
eating, they're stress.
Inflammatories.
Yeah,
Yeah.
a lot of that.
Stop fighting people on Instagram, Derek. Maybe that's what's causing it. So
Could be.
when do you guys, or I'm guessing you guys have good relationships with like local dermatologists and you guys probably refer back and forth. Is that like a thing, or do dermatologists, because they have a PhD and a doctorate, they look down on what you guys do? Or do you guys have pretty healthy relationships with having people to talk back and forth with?
I don't typically refer like that. Usually I tell them to, check out their insurance. What basically providers are available to them. I don't really get involved in that realm, but I do recommend this is a dermatology issue. You need to have a medical evaluation.
Yeah.
Yeah. And most of them are pretty cool. Yeah, most of them have med spas in their own offices now too.
Yeah.
So they're pretty cool if you
They get it.
go. Yeah.
I went to a dermatologist. It's a kind of gross story, so sorry, people that are still listening. I went to a dermatologist because from jiu-jitsu, I got some type of weird thing on my knee. To this day, I don't know what it was, but it was disgusting. And I went in there, and like she literally came in with like a razor blade and a lighter, just went cauterized it, and I was like,
You had a boil probably.
I was like, I could have done that at home with a clean razor blade and my own cigar lighter. Because it looked just like a cigar lighter torch. I was like, how much are you going to charge my insurance for that? She's like, well, I'm not a doctor. She was a PA or maybe she was just a nurse. I don't know what. And she's just like, I don't know, probably not as much as the doctor would have done it, but we'll probably charge you like $2,700. Like I could have done that for $150 in my backyard, but she said that probably wouldn't have been a good idea. So if I had to do it all over again, maybe I'd be a dermatologist, like work normal hours and just work on people's skin, not have to look inside or anything like that.
Some pretty nasty stuff. They have to do that.
That's fair. That's fair. What did I forget to ask you, either about the business itself or the products that you guys offer and the things that you're trying to do? Like, the reason, because I'm very ethical and I don't need the business's money that much, but in getting to know all the people there, like I just know you guys are doing the right things and you're actually taking a consultative approach, and you guys aren't just, like you said, trying to sell them a needle full of filler. Like I really appreciate what you guys are doing, even though this is not my world. I can tell when a business is ethical. I've done enough loans and I've talked to enough business owners to know when they're doing things the right way and the wrong way. But what did I forget to ask you, if anything, either about the treatments or something I missed?
I mean, I just want to add that as an advanced esthetician, I have to work under a medical provider. So anything beyond a facial does need a medical clearance. And so you have to, rule out any potential adverse reactions or complications, things like that. People do have to be cleared for certain procedures, whether it be laser or skin tightening treatments. So I just want to, that is
a real medical practice.
That is the difference.
Your owner is a doctor for a reason.
Medical
right?
aesthetic practice.
Right. So any of the treatments we do have to be medically cleared from an advanced provider, and that's either our NP or our doctor. That anything that we do, he has to do a face-to-face with them if he's not on site, and we go through an extensive medical history with them to make sure that it's safe to get any of the treatments that we're providing.
I'm going to put you on the spot. How much younger can you make somebody look? Let's say they're just starting the journey on having a gym for their skin, and they're going to do whatever you recommend, whatever that thing is.
I'll be honest with you. Most people aren't even necessarily looking to look younger. They just want to look their best selves.
Yeah, that makes sense.
They want to look healthier. They want their skin to look healthier. They want
Not tired.
Exactly. Yeah.
Healthier is a good.
Want to look
I
tired.
don't want to look tired. Healthier is a really good one. Because
it's because healthy skin is glowy, and healthy skin does look younger, looks more vibrant. But most of the women that come in to see us are in there somewhere between younger ladies too, but 35 to 75. That's the range that's the typical patient that we're seeing in that range. And the average female that's in their 50s, they say, I don't want to look 20 years younger. Right. I just want to look the best version of myself. They're happy with the age that they're at.
Right.
You know what I mean? They just want to look the best of version of themselves.
Right. And without having to do any type of plastic surgery, because you start doing a facelift, you got to do that every 10 years.
Yeah.
And costly. I mean, a good facelift can start at $40,000.
And we've seen some celebrities where they probably should have stopped.
But the really good one is the deep plane, and those start at $150,000. Those are the ones you can't detect.
$150,000 per
$3,000, yeah, because they're going deep plane. They're going down and repositioning off from the bone. Yeah, instead of just pulling back, they literally reposition your whole face, and they're putting fat grafts and stuff in. So, yeah, it's called a deep plane facelift, and that's the trend that is going right
Dude,
now.
you guys are a bargain versus $150,000 surgery.
If and you can delay it. I mean, there's a lot of stuff that's going to help us delay or help anybody to delay any type of facelift if that's what you're choosing. But a lot of people are choosing not to do that. They just want to kind of age gracefully.
Yeah.
And still look young and healthy, but not look like our parents did.
I love
they were the same age.
I put you guys on the spot and you gave, to me, like the perfect honest answer, right? It's like, I can't necessarily make you look 10 years younger because that's maybe not even what you want, right? But I can make you look the best version of yourself, which I think is the perfect unrehearsed answer because you didn't know I was going to ask you that question.
Well, I would put myself in hot water if I told you and I promised you I can make, and you're going to say, hey,
yeah,
what happened here?
For me to be 10 years younger, I would have to stop eating for about 3 months. That's what would make me look 10 years younger. But hey, I appreciate you two being on. How can people find you? Obviously, Ethereal Med Spa, you can get in touch with them. You can book either Natalie or Pam, either way. But I know that you also have like your individual Instagrams where people can follow and see what you guys are doing. So do you remember off the top of your head what those are if you want to give those out?
Well, my Instagram is at Vegas_Esty, and that's Esty with an A.
AES.
AESTHI, short for esthetician. There are 2 ways to spell esthetician.
Felt so good about that because I kept spelling it wrong.
Old school, so I went with the A.
Perfect. So ST.
Yeah.
And then what about yourself?
And mine is, I always forget it. It's RN. No.
We'll get in the show notes. People will just click the notes or the YouTube comments. But seriously, thank you for coming in. I know this is not your zone of expertise getting interviewed, but Doc said you had to come in and talk about what you guys do because you guys do an awesome job. And I want to have you guys back in a couple months, hopefully after everything passes with the amino acids, and talk a little bit about that, because
peptides.
It does feel like peptides can be the wonder drug to cure a lot of problems, and more people should know about it.
Yeah.
And my opinion, not the opinion of Ethereal Med Spa, my opinion, Scott Groves, the fact that the pharmaceutical companies are trying to keep those out of the public limelight means they must do a good job at a cheaper cost. So I would love to talk to you more about that if you're up for it. Thank you so much for being on.
Thank you.
You're welcome. Thank you.
Hey, it's Scott Groves with the Henderson HQ podcast. I hope you got something out of that episode. If you enjoyed it, please don't forget to like, comment, and subscribe to the podcast. It really helps the show grow. And by the way, if you are a business owner or you know a business owner who has an interesting product, service, or just an interesting backstory, please get in touch with us. Email us at thehendersonhq@gmail.com. We would love to interview you because that's what this show is all about. It's about building community, supporting local, individually owned businesses, and just making Henderson a great place to live. And don't forget, go to hendersonhq.com and make sure you sign up for our newsletter. We send out a once-a-week newsletter, no spam, about the most interesting local businesses, hotspots, restaurants, community events. Thanks for watching the show. Really appreciate you.